Hi everyone, this is Dr. Sonali from Sunrise Learning. I often see that when a child is showing some red flags in the development, like if a 2-year-old child seems to be withdrawn and disconnected, or say when a 3-year-old child is not able to communicate effectively and meaningfully, or when a 4-year-old is not speaking some words and say not playing with his peers like a regular 4-year-old, I often see that instead of going to a developmental pediatrician or a clinical psychologist, many parents often visit a speech therapist, and then they start the intervention without getting a complete diagnostic and functional assessment of their child. In fact, when they come to us, they often do not even know what is the actual diagnosis of their child. They focus on the symptom of no speech and begin work on that. So I can say this is exactly like if you have a stomach ache and you go to the pharmacist and you take a tablet without going to the doctor for a clinical examination and without getting the tests to understand the diagnosis, the condition that is causing the stomach pain. Similarly, when your child seems to be showing some lag, some deviations, some delays in the development, please do not be reluctant of going to a clinical psychologist or a developmental pediatrician for a detailed assessment and evaluation. Take the test. Don't hesitate. I know it must be very overwhelming to even imagine, what if they put a label or a tag on my child? What if they give a diagnosis which is of a lifetime condition? And maybe you have questions like, why should I even invest so much energy, effort, time, money into getting an assessment done? It is going to take a lot of time. There'll be so many sittings. There'll be so many question answer sessions. So why should I even invest so much time and energy into getting an assessment when I know that all my child needs is some speech therapy, and then he will start speaking and then everything will be okay? So I understand that you have these questions in your mind, and then you choose to do what you do. Definitely, agreed. You should for sure start intervention with a speech therapist for the deficit that the child seems to have. And that is what we called as a deficit-based approach. Your child shows a deficit and you approach it with intervention. But then don't ignore the real reason, the cause for that speech delay. You need to find out the cause. Make sure that you request for a full functional diagnostic assessment and then understand the report completely. Ask your questions and then start a holistic intervention plan. Holistic. Look at the whole child and all the domains of development, the play skills of the child, the social interaction, the connection with the environment, the anxiety, if at all there is any, with the surroundings, with the environment, if there are any sensory integration difficulties. What are the foundation skills of the child? Is he able to give joint attention? Is he able to point and communicate? Is there some sitting tolerance that you can start working on? How is the attention span? How is the non-verbal communication and overall participation? Don't just look at the speech component of the child's development. That is a little higher area. So yes, remember, every time you come across a child or you have a child who has some delays in development, and if you feel the very obvious symptom that comes across to you is a lack of speech, don't just look at that particular area. Make sure that you go in for a comprehensive assessment evaluation with a developmental pediatrician or a clinical psychologist. Find out what's causing these delays in the development, and then begin the intervention. Or even if you have begun the intervention, make sure that you start the assessment evaluation process also timely, so that you know what is stopping your child from shining and blossoming. Thank you.